Now, did he get chemotherapy and radiation before the surgery?
Not, it's 2 years and 8 months since he's had that.
Okay. But one of the side effects of radiation in particular is tissues don't heal as well as they would if you didn't get radiation. And so, obviously, if you got radiation right before the surgery, there would be a much higher risk of this happening. But still, there's a risk of it. And it sounds like during the operation, it was a very difficult operation. That also places patients at risk of this not healing. And the right side, whenever you do a right-sided surgery, is even more risky for this happening. From what it looks like, he has a small hole in his air passageway. It's not a huge hole, because if it were a huge hole, he probably would not have made it this far. He just would not have been able to provide air into his lung. All of the air would have leaked out into this side through the hole, and his left lung would not have been able to, wouldn't have been able to what we call ventilate or breathe for him, even with the breathing machine. So fortunately, it's a small hole. The problem is that, give us a couple minutes here, sir. As a matter of fact, there's a smaller room next
Yeah,
door.
that's
Why don't we
fine.
go over there. We'll just have you guys have a seat in this room here. I apologize. Now, even though it's a small hole, the problem is, you can imagine you have a bunch of bacteria in your air passageway, and that gets out into your airspace, so inside of the chest cavity. So all of that is infected. And so what we have to do is drain it, and that's why I asked Dr. Thompson to put the drainage tube in before he left. That serves two purposes. Number one, it drains whatever is in there, and it helps to evacuate the infection. But number two, if you have a hole in the stump, in the remaining portion of your airway, you can have fluid go into that hole and leak in onto the good side. And you don't, that's the absolute last defense. You can't have that left side infected. You don't want to get pneumonia over there. It's going to be a major problem. And so that tube is designed to evacuate the infection and also to protect the left lung. And I wanted that to happen before anything commenced in terms of transferring him here. So by default, he now has an infection over here. That is called an empyema. That's just a fancy term for an infection inside of the chest. Okay? What we need to do is to clear up that infection. And the way that we do that is we're going to have to take him to the operating room and basically wash out that area. And I'm probably going to have to make a couple of incisions in his chest, go in. He's going to have what we call fresh granulation tissue, which is healing tissue. It's kind of like a kid scrapes their knee on a skateboard and they get that kind of beefy looking, you have the same stuff inside of the chest cavity. Now, he's on a blood thinner. And it's one of these blood thinners that we have no means of reversing. And we have to allow it to kind of reverse on its own. And so it can take 3 to 5 days. And what I'm going to do is put him on the OR schedule for Monday, and if not Monday, definitely Tuesday, to go in and wash out his chest. That'll give some time for that anticoagulant, the blood thinner medication, to reverse, and it will minimize the risk of him having any bleeding related to whatever I do. Okay? If I take him tonight, we may run that risk. Another thing with tonight is that none of my usual crew that does thoracic surgery with me, that knows all of the ins and outs with the instrumentation. I know the ins and outs with the instrumentation, but I also need staff available who also know it. When I ask for an instrument, they know exactly what I want. None of those guys are here. They will be here on Monday and Tuesday of next week. So it's kind of a blessing in disguise that he's on this blood thinner medication anyway. Right now he's stable. His oxygen level is stable. His blood pressure is stable. So I don't see any need to do anything beyond what was done back at Terrebonne General. He has a drainage tube in place, and we are able to adequately breathe for him with the breathing machine. So I will just let him cool off, let that blood thinner medication get out of the system, take him, wash that area out. And this is going to be a long process. We'll wash him out. He may even have to have a couple of trips to the OR to be washed out. And at some point, we may even have to make an opening in his chest over on the side. It's called a flap, an LOS or flap. That's the name of the opening. But what it is you create an opening and you leave it open and you pack it. and you allow things to heal from the inside out. Okay, and this is an approach that was it's been available and been in use for decades, a good probably 40, 50 years, if not longer. And it was initially used to treat people with tuberculosis, which is a horrible type of an infection. And it's very successful at clearing up the infection. It just takes time, okay? So initially we'll make the small incisions, go in, wash out his chest cavity. We'll probably leave a couple of drainage tubes in place. I may even leave some antibiotic solution inside of his chest cavity with those tubes in place. And then later on down the line, go in and create this flap. There is also the possibility that we may have to put some muscle into his chest. Whenever you have your lung taken out, your chest is a cavity, and so you have this huge space. And it's kind of like having a pothole on a highway. What happens every time it rains? You get a puddle. And so likewise, if you have this big, wide open chest cavity and that lung has been removed, you have this big, wide open space, and if your body wants to produce pus or an infection, it has a space to collect in. So what do? You do something to obliterate or occupy that space. And one of the other things that we can do is sometimes we will place muscle from the chest wall. Sometimes we'll even take fat from inside the abdomen and transpose it into the chest cavity to occupy that space. And that way there's nowhere for the fluid to collect even if it wants to. It's akin to putting asphalt into a pothole. It can rain until the cows come home, but you won't get a pump. He's not at that stage yet. We have to make sure that we have cleared the infection as best as is possible before we do anything like that. Okay? So this is a long process. I don't want to paint a rosy picture for you. He is critically ill. There is a solution for this, but it's going to take some time, and I cannot stress that enough. He may or may not have to have a trach tube placed. I don't know. But if he has to have a trach tube placed, that is temporary. There's a difference between a